Hi, my name's Faith Perry. I want to say to the world, long time no see, because the last time I made a video, I was 12 weeks pregnant, and I was making a video about how hard it is to sleep as it is at 12 weeks, because you have to go to the bathroom every minute. And then my husband made it harder, by flopping like a fish. He like fly this way, fly that way, or my shoulder hurts, or he'd be like, I can't sleep on this side, can't sleep on this side, and then he'd be like, my neck hurts, and all these. Then he'll get up, and this is 10 o'clock at night. The house be clean. He'll dust some furniture. All of a sudden, and he'll sound like me. I need cough medicine. Even ain't nothing wrong with him, and stuff. But now I'm 27 weeks with twins. With twins. I probably didn't look very pregnant then. But boy, do I look pregnant now, don't I? Well, I'm gonna be 27 weeks in 2 days, so might as well say 27 weeks. And they had this they flop like a fish in there. And when the ultrasounds, one was going like this, one of them went like this, and one of them went stretched and went like they were tired or something after they stretched. So they had this. No, twins though, not triplets. I talk about different ultrasounds, different times they did different funny stuff. And I was gonna do one an update every month instead of doing one every week, like some people, cause and not put down the ones that do one every week if they like doing it. That's their prerogative too. I just there ain't much change that happens to your body in the twins. I mean, a baby, in my case, twins. Um, when you do one every week, that's why I wanted to do one every month. But I've been busy between going to the doctors every 2 weeks, and in between seeing my regular doctor, clean the house, taking care of my three wonderful kids. I said wonderful, I didn't say perfect. Because she's laughing because she knows she could be a brat at times. Yeah, she could talk. She wants to talk.
Um, she has a hospital bag for since the hospital combs are cheap, like the Dollar Tree combs. The soap is like this big, and the shampoo is like this big, and it's basically water. So yeah.
Yeah. Here's one of the ones receiving blanket. Here's another receiving blanket. Oh, I got names for the babies. Their names are gonna be Aliana, Olivia Perry, and the other name is gonna be Serenity Lee Perry, and that's gonna be the receiving blankets which I bring home in. This is gonna be so cute. One of the baby's outfits. I get it at the Bourbon Coat Factory. Oh, I'm producing colostrum, but I've been producing colostrum. But this is what my daughter was talking about. They give you in the hospital cheap men's combs to comb your hair with.
Yeah.
And I'm sorry, look how thick my hair is. There's no way you be able to nicely
Yeah, you know.
comb your hair after you give birth. Those cheap, so this is $1 one even. It's a lot better than hospital ones.
Okay, and then she got toothpaste.
I might be there for 5 to 6 days because I might end up having a C-section and I might not have to have a C-section because A is twins, depending on the position of baby B of Eliana. I mean, because Serenity, she's head first. But if Eliana stays butt first, it had to be C-section. But she either moves feet first or head first. Here's my toothbrush. Because the toothbrush you get is crummy too. Here's my soap. Because you only get these little bitty soaps in the hospital each day. And let's face it, I'm not trying to be funny. But I'm not super big, but I'm not super skinny either. A skinny person with a lot more soap than you get in the hospital. And I might be there for 5 or 6 days. These are going to be my pads that I'm going to wear when I go home. But I ain't going to use them until I get home. Because I like the hospital pads. I really do. That's the only thing I like about hospitals. The stuff they give you. And that and the diapers. Shampoo I'm packing in my baby bags. Because you got to take stuff home for you too, right? Yourself. Hopefully. Because you only get these little bitty tubes. And that's enough, as thick as my hair is, to maybe like do this much hair for a good ladder. As thick and stuff as my hair is. Because I had to call the nurse, ask for more shampoo. My razor. Because I do not want to go home with hairy legs. Armpits. I know I'm fussy, right? I still gotta pack my going home clothes. The only thing I ain't gonna pack is in these 3 bags that I had to take is my nightgown, because as bad as those nightgowns are, I'd rather ruin the hospital nightgowns, which they throw away anyhow, than ruin my nightgown. Shaving gel, deodorant, stuff you don't get at a hospital because you don't get shaving. The other outfit. Socks. And I told my daughter she could keep the socks in there if she wants. But I don't know why she wants socks, because the outfit she picks out already had little booties in them. Baby wipes. Reason I'm packing my own baby wipes is because the ones at the hospital are dry and you have to get them wet with water to use them. And they probably don't like, babies probably don't like that cold feeling against their skin. I know I wouldn't want to do that. Have someone put cold stuff against my skin. No way, no way. I'd probably be like, wah! So, just pray that my pregnancy continues to be healthy, because I was having some problems. Not with the babies, but with the babies are growing fine, because baby A, the bigger one, she's 1 pound 9 ounces. Baby B, Aliana, she's the one that's 1 pound 6 ounces. And um yeah, so they're growing fine, but they're probably more than that now because that was a week and 3 days ago when Dr. Dokart, he's a wonderful doctor, checked out in the size of the twins, and so is Dr. Meta. But his job is to check, do an ultrasound, check on the size of the twins, check on how the brain is developing, and the position of the twins, and make sure they're growing okay. Dr. Meta, his job is to make sure that the baby's heartbeat is okay, make sure the uterus is stretching okay, make sure I'm healthy. That's why I was put on bed rest. I'm healthy now. My blood pressure went back down to normal, but they still want me in resting for the most part. As whenever I can. Sometimes I can't, cause I gotta clean. I gotta walk back and forth to the school. Here's the snowsuit we picked out for one of the twins. Here's the other snowsuit. I'm gonna get another cloth one too, in case it ain't that cold out. Cause I do that in this December 24th, and nothing frustrates me more when everybody says, "When you do, didn't you have to do?" I thought you were supposed to go give birth in this September. I don't know how this heard September when I said December 24th. I even said they're supposed to be Christmas babies, even. And somehow they heard September. I don't know since when you had Christmas in September. And way back when I was 6 weeks, they're pregnant. They're like, "You mean you didn't give birth to those babies yet?" I'm like, "Come on, I just got done telling you it was only 6 weeks." Either people aren't listening, B, they don't care, or they're dinglings and don't realize you're supposed to go 40 weeks. And one person said to me, a week after I told him I was 6 months, "Aren't you 7 months yet?" I said it was just a week ago when you asked me how far along I was. I said 6 months. You ain't gonna jump from 6 months pregnant to 7 months pregnant in a week. It takes 30 days to go through a month.
And she said, "Oh, yeah, that's right."
And my daughter packed all these diapers. She's a sweetie. Sometimes I just wanna wring this child's neck, but I really won't. But why did she pack so many diapers? I don't know, because you're more welcome to use the hospital diapers the whole time you're there. And in fact, even though you don't get to take none with you now, you're still more welcome to use the hospital diapers while you're there. I don't even plan to put the twins into these diapers until they have a signed release papers, which is usually about 72 hours after you give birth, because they gotta check on your health, check on the baby's health, and it takes them all day to release you. So even after your 72 hours up, you still gotta wait till the next time when the doctor can come and see you before you get to sign those release papers. One time, I had to wait till 6 p.m. the next morning day. My 72 hours up. The reason that's getting stopped for 72 hours, usually I have what they call beta strep every pregnancy so far.
What's that?
And that's a strep that you get in your vaginal area. And, yeah, that some pregnant women get. Antibiotics and stuff so that your unborn child don't get it. But that's why me and the babies have to stay for 72 hours because they gotta make sure the babies don't have any signs of beta strep. And I personally also, because I don't want any medication, I did with two of my other kids. But I'm so tired of being so numb with that. I don't know when to push. So they had to tell me to push when I'm that numb. I already feel some pain. And then the only way I let medication if they had to do an emergency C-section. I already feel some pain and know when to push. And then feel no pain and not even know when to push. Be told time to push. As far as any symptoms I don't really have any. I did have horrible backaches, but now they shifted. The baby shifted, and they're like not pressing way down against my bladder, but they're not way up here. So the babies are like down here more now, and because they shifted, it's easier for me to walk. Now I have to walk like this or like this. Now I can just walk. So my back.
Exercise.
No, this child. So my headaches are gone. My dizziness is gone. Yeah. The only thing that I've been having trouble with on and off is a lot of constipation. Lots of constipation at times. And I end up taking milk of magnesia. The only other medicine you can have besides regular strength Tylenol. But I haven't been having headaches since all that hot weather went away. Had I had any weird cravings? No, not really.
My dad mostly was.
Um, only thing I've been like craving most is pickles.
What about Daddy's craving? When you were pregnant with me.
That totally makes sense.
We were talking about craving.
And my daughter wants to talk about cravings that my husband had while I was pregnant with her, but that don't even make sense. We talk about this pregnancy. That's why it don't make sense. And because I had to pack two of everything though, because of twins, the two outfits, two receiving blankets, some stuff I want for myself, I probably pack a book, like Heaven's for Real. Um, because in the beginning of labor, you ain't gonna feel a lot of pain, so that'd be a good time to relax. Cause I know I probably won't start hurting bad until 6 or 7 um centimeters dilated. Then it'd be hurting. Um, cause I know like 2 centimeters, 3 centimeters, 4, you still can breathe, you still can get comfortable. And when you hit like 5 or 6, then it hurts more. 7, then you just, oh, then it's really painful. The other two I had an epidural. My first child I had nothing, but now I want to go back to having nothing again. Cause one, um, I get tired of being in the bed and laying in the hospital bed, not be able to move around. Had to have a nurse come bring the bedpan to you, and cause you're so numb you can't walk. Have cause at least if you had no medication, you could get up, move around. Um, the other reason too, long time ago, this social worker tried to trick me into signing doctor papers because they thought this is how stupid they are. They thought state law, okay, is gonna drug you up enough to make you think that you don't notice the word adoption. And I took those papers and ripped them in half and said, I'm not that damn drugged up lady. You want to try something stronger? Because Stanol is only supposed to be a little bit stronger than Tylenol, and that's how dumb she is. Um, um, it's harder to like move around in my bed at night and find a position that's comfortable and stuff. Um, that's about it. My kids are super excited. So am I, because they're telling me the only way I can miscarriage now if I fall on my stomach or get kicked or anything like that. And so they say that they're not saying that it's 100%, but pretty much. I I just hope that pray that my blood pressure still just stays down back to normal, even though it wasn't life threatening. Um, that the babies continue to be healthy, they continue to grow, because if you want to heavier than the other, it don't matter. And usually, Eliana, she usually catches up with Serenity in a couple weeks anyways, so they'll be about the same size again, a little bit closer in size next time. And I'll see you next month, hopefully. This time hopefully I don't forget to update. Bye.
Bye. Bye.